What's on the table and what's not when it comes to privatization?
Nothing is on the table in terms of privatization. I can't be more clear on this, Ryan. We are not privatizing healthcare in Alberta. It is a publicly funded, publicly delivered healthcare system, and that will continue. What we are focused on is really improving service delivery and making sure that patients get the quality service they deserve, not just now, but into the future. We have to take into account that we have an aging population, and we have to make sure that our continuing care services are up to the challenge that we will be facing. We need to bolster our primary care so that, in fact, we keep people healthy and out of hospital. So we really are, that will be the challenge to Dr. Oberg as the chair, to look at AHS as it currently exists, make sure that as we start to look at what areas should be under the new governance structure of primary care, continuing care, and mental health and addictions, that we have a thoughtful process in disseminating that. But at the end of the day, it is really to provide quality patient care with outcomes that are very transparent for everyone to see, and also to make sure that our workforce, who really deliver the care, and we have amazing healthcare professionals right across this province, and we want to make sure that they have a really good work-life balance, that they're able to contribute, and that they're being listened to. Because right now I hear often from our workforce that they're not actually listened to.
Okay, I just want to be clear, because I know that the Alberta Surgical Initiative, this is news we were looking at just about a month ago. There was talk of a private facility to cut wait times for weight loss surgery in particular. I'll give credit to Michelle Bellefontaine from the CBC for reporting on that. So are you saying no private surgical clinics? You're saying no private operators in any context? No hospitals are for sale? No long-term care centers are for sale? There's no fine print? There's no privatization plan, period?
There is no privatization of healthcare. We adhere to the Alberta Health Insurance Act, and we also adhere to the Canada Health Act. And those items, those areas that are insured, those surgeries and medical procedures that are insured will continue to be insured and covered. Obviously, there's many things that are not covered that we currently have access to, whether it's cosmetic procedures, etc. Those facilities will still continue to exist. We have chartered surgical facilities that are dealing with the backlogs of our surgery wait list, that those surgeries are being performed, yes, in clinics that are run by physicians that also perhaps do other surgeries that are not covered under the Canada Health Act or under the Alberta Insurance Health Act. But those items that are covered will continue to be publicly covered. So I'm not sure what you're getting at.
Oh, I'm just asking a question I think a lot of people are asking, which, they're curious about privatization and what impact that might have on the system, and where the line might be drawn, and what the government might explore as a private option and what the government might not. Fair question at this point. I know you've got to run.
And maybe I'll just be a little bit more clear, just so that it's very clear. We are not privatizing healthcare in Alberta. So those items that are covered currently will continue to be covered currently. And we will look to making sure that Albertans have more access to these services. Really, it's about improving access. We have really long wait lists for surgeries, much needed surgeries. I hear daily from Albertans that have problems. They have a hip surgery that's much needed, and unfortunately, it's 18 months or 2 years away. We need to correct that. And so our focus is going to be to really making sure that we can get those wait times shortened and eliminated, is my general overall hope.